Welcome back to Dog Health News. I'm Roberta Chadis, and this show is dedicated to keeping dogs healthy and also trying to help dog parents find strategies that will keep their dogs well and not spend a lot of money on them. So today, I am very excited to have Ann Springer with us. And Ann Springer comes to this show with many years of experience. So I want to have her introduce you to her and her background, because it's really unique, and it's just such a pleasure to have you here, Ann. Welcome to Dog Health News.
Thank you, Roberta. Thank you very much for having me.
So let's start off with how you got in this business and your road. How did you get where you are now?
Well, I've actually been a dog owner since age 7, and I'm now qualified to be a senior in the Commonwealth of Massachusetts. I've passed my 6th decade. I'm not going to keep going with that. But,
me too.
but I've been a dog owner almost all my life. And I've had several careers, a couple of which have involved animal behavior. One is that I, in my younger days, was a horseback riding instructor. And then in later years decided to become a professional dog trainer. So I've been training professionally for a couple of decades, 2 or 3. And I own and operate a training business in Danvers, Massachusetts. I also have an additional role in that I work as Senior Care's Public Relations Director and Manager of the Positive Connections Program. So Senior Care is our area agency on aging that handles aging and disability issues for people in the area from Beverly up through Cape Ann. And the program that I operate, Positive Connections, handles pet issues for those people who are elders or who have disabilities. And we provide some direct service to them in our own catchment area, but we also provide information and referral on all manner of pet issues for any person in the Commonwealth who is in that elder or adult with disability category, or their families if they're struggling with any issue affecting pets or pet health.
Let's stop there and talk about the struggles that people can have, even with the weather here in New England. You talk about struggles.
Right.
You don't want to have to get out of your house to have to walk the dog. What does that do for some seniors?
Well, you know, that reminds me of a story of a gentleman here in Beverly, actually, and this was many years ago. The gentleman's no longer with us, sadly, but he had had a stroke. And he lived with a very large breed dog. And I got a call one day from a visiting nurse who said, I'm very worried about this gentleman. I think he's going to trip on the dog. He can't make it to the door in time. You know, and of course, the dog needs to go out and eliminate. And this man could no longer really walk his dog safely. So I actually called a family member and suggested to them an alternative that we could, you know, perhaps fence the yard even inexpensively with wire fencing from the hardware store or whatever, if the family was willing to go in and do that work. You know, they didn't have a lot of money, but they certainly had some manpower that they were willing to lend to their dad. And so they did that. They fenced the yard in, and they actually put a tie at the doorway so the gentleman could hook his dog up inside the home, then open the door, and the dog would go out on his lead to go do his business and then come back in. And a family member came occasionally to clean up and to also give the dog some more you know, aerobic exercise, if you will. So problem solved, and the gentleman got to keep his dog, whom he loved, and you know, we basically solved his problem. But it does become a struggle sometimes because of physical inadequacies on the part of the owner, financial problems. We have a lot of people who come upon hard times financially, either because they've just aged into the Social Security system and weren't so fortunate during their younger lives to save a lot of money. And when they wind down their resources, sometimes it becomes difficult to care for the pet in terms of veterinary access. So we have some programs and solutions for that, whether it be referring them to a charitable organization or to providing a small grant. You know, the more donations we get, the more monies we can provide to people for those kinds of issues. So,
well, you're bringing up a lot of issues.
Yeah.
And I can't help but think about the issues of elders, both dogs as they get older,
Right.
and also people who get older. But I really want to talk about the bonding that makes it a healthy relationship. And I can see that there are ways of dealing with the challenges.
Right.
But let's talk about the benefits for having an animal.
Well, we know from science that people who have animals in the home or animals that they're bonded with have better outcomes in terms of blood pressure and things of that nature. Okay. There was actually an interesting study done at a university in Alabama by a registered nurse that showed that people who have animals in the home actually have better cohesive relationships with their family members, which I thought was interesting. And I actually did my undergraduate research project on whether or not families provided more care to the elder in their homes when there was an animal in the home in terms of their what we call activities of daily living. So things like, you know, the bathing and the dressing and things that people might need assistance with. And while it wasn't a statistically significant difference, there was a difference. And what we found was that when I went before the people who review those sorts of things when you're in college, I had a professor from Fitchburg State approach me, and he said that he thought that if I was able to obtain a larger sample, that I would probably see a statistical difference.
So what you're saying is that if I had a mother who had a dog, I might just be more kind.
More kind to your mother, more inclined to help her with those issues. And it didn't seem to matter who owned the pet. What we looked at was simply, was there a pet in the home? So some of the elders lived with a family member, and the pet might have belonged to the family member. But they still received that amount of care from the people in the home.
It is very interesting. I happen to spend a little time in a nursing home, assisted living area, and there are dogs that come in. And I will just say that as soon as the people who live there see a dog, their eyes light up.
Right.
There's something that changes, and they smile. There's just, even if it's just a little smile. And they want to know about the dog. They want to know what's happening with the dog. What kind of dog is it? So what do you think that does? What do you think?
Well, you know, I've had that experience myself because over the years I've handled 3 therapy dogs. And they were of various breeds and sizes, and the reaction to them is almost always the same. It's that brightening that you mentioned. I've had the experience, and you know, it's almost become trite in the industry because people talk about all the time, you know, the Alzheimer's victim who hasn't spoken to anybody for a long time, and suddenly you bring a dog into the room and they're telling the dog you're beautiful and patting their head. I've had that experience, literally, of seeing my dogs have that reaction from someone. And so it is that catalyst sometimes for a connection to some reality or some good feeling from the past. Some people will actually, you know, we caution therapy dog handlers that have small dogs, don't give them up to the person in the nursing home. You may not be able to get them back because truly we cannot wrest things out of the grip of people who are in that setting. You know, it's for their safety. So we caution the handlers, keep hold of your own dog and just let the person pat, so that otherwise you may have to leave it there. You know, so it's kind of a joke among the handlers. But truly, people have that connection and they want it and they crave it, and we're happy to provide it when we can.
And then now let's switch a little bit to the dog themselves.
Right.
The dog, the training that is involved.
Yeah, you know, everybody that approaches me, because I am a trainer and we do a lot of work training the foundation work for therapy work at our training facility. Everybody wants their dog to be a therapy dog because the people that do this work love people and they want to help. The fact is that not all dogs are cut out for the work. So what we tell people is your dog may be a candidate if they are well trained, because you know, people in the nursing home setting may have thin skin, they can't take the effervescence, if you will, of that wiggly, wonderful dog at home that just loves everybody and wants to climb all over you, you know, that sort of thing. But also, they must love, love, love people, and they must love, love, love other dogs. And that sometimes is where we have the problem, because everybody tries to socialize their puppies to human beings when they're young, and they think that if the dog loves people, that's all that's necessary. But in today's world, in skilled nursing facilities or hospitals, you may also find that people are bringing their pet dogs to visit family members. You may have to ride up the elevator with another dog 2 feet away from your dog, and your dog needs to be able to turn and face you and not face the other dog and not get into scuffles and all of that kind of thing that, that dogs normally do. You know, all that behavior is normal dog behavior, but your dog has to be savvy enough and comfortable enough socially with other dogs that they're not like pulling you to meet them, and they're not escaping their own space to invade someone else's and all of that. So it takes training, it takes socialization, and basically it does take a dog with an exceptionally stable, natural temperament.
The question I wanted to ask was, are they trained to turn towards you?
Yes, absolutely. We train all behaviors. Turn toward the handler. We train paws up, paws down. For those people, we have people that are, you know, they're bedbound and maybe they can't reach, so the dog can go to them. We can ask a dog to paws up on somebody in a wheelchair if they desire it and it's safe for them.
I see.
And so when you put behaviors like that on cue, you're basically not getting those behaviors without the cue. We call it stimulus control in the training jargon. But the dog needs to be able to answer basic cues. They need to be able to stay. Or one of the critical ones for dogs in a therapeutic environment is the cue to leave it, because people, especially people who may have motor difficulties, they may drop you know, soiled tissues on the floor. They may drop a spoon with applesauce after the nurse comes in to give them medication. And the dog has to be able to, no, not going there. So.
No, I was noticing just yesterday that this little dog was sniffing around. He knew where the food had dropped. And there were not much you know, for him to grab onto, but he was sniffing away. So I had this other question. Is that why there are so many golden retrievers and Labradors?
Well, those breeds, as a rule, as a breed generalization, and I have to qualify that with, you know, there was a very excellent therapy dog that used to go to Caldwell Nursing Home in Ipswich for many, many years. I think it was like every other Tuesday for years and years. She was an American Staffordshire Terrier, so came from that class of dogs that people sometimes fear. Wonderful therapy dog, just an excellent dog all around. But in general, the best therapy dogs tend to come from retriever breeds, gun dog breeds that are quiet. Boykin Spaniels, I mean, that's a classic. They call it the old lady's dog because they're so slow and quiet and generally, you know, mellow. But that is an oversimplification of what is necessary. We have golden retrievers that are aggressive, that I see for behavior consultations. So breed alone is not the criterion. It really boils down to the dog's individual temperament and to their individual training.
And speaking of training, I know you have a lot to say about training.
Yeah.
And I'd like to hear it. I think that our audience would be interested in hearing about your philosophy and your experience in the training area.
Right. Well, you know, I've been training long enough that I was originally from the era where people trained dogs, and of course I was never terribly rough with dogs or anything like that. I don't mean to suggest that, but basically it was a coercive system. Dog does a behavior, and if you don't like it, you correct it. And I've altered my philosophy considerably over the years, and I now practice what is called force-free training, which means that the dog is reinforced for good behavior. There are consequences if the dog does not do the proper behavior, but they never involve fear or pain. So for example, one of the major things we now might do in a situation like that is to withhold reinforcement. And dogs understand it. So for example, we were talking about the leave it cue a minute ago. And by the way, I do call things cues and not commands, because I have employees, not slaves.
That's a good point.
Yeah, but the leave it cue is basically taught by, for example, if I have a piece of food in my hand and I hold it to the dog's nose and the dog mouths on my hand and all that, I just wait. Sooner or later, the dog figures out, wait a minute, the hand isn't opening. What's wrong with this picture? They back their mouth off just a hair. And at that very moment, I would just say yes, and I would open the hand. So what the dog learns is, I get this by not behaving in a way that is mowing on the hand, and you
try this
extend
on
that.
people, I
yeah,
think.
oh yeah, absolutely. You know, it works. It's called tag teach.
So
Clicker training for
just
humans.
thinking about a few people I'd like to try that on.
Yeah, but it does work. I mean, all the 4 quadrants of operant conditioning that Skinner worked with back in the day, they all work. The problem with the punishment side and the negative reinforcement side is that they have fallout. And the fallout is that you teach the dog to fear the handler or to fear a consequence, hence they lower globally their behavior, or they avoid and escape things to make life more pleasant.
Which makes them frustrated.
It can, but also, for example, let's say your dog is afraid of children. And so you allow the dog to avoid children whenever they want, because that's an aversive stimulus, and you think, well, if I let my dog avoid them, then he doesn't get into an altercation with children and everything will be fine. Not exactly, because what can happen is the dog gets suddenly cornered by a child, or 2 children approach. So that trigger that the dog was fearful of now becomes what we call trigger stacked in the jargon again. And so the dog might really go over his threshold for remaining calm and snap at the child, or even bite a child. So we prefer to change dogs' opinions of those kinds of stimuli using what we call desensitization and counter-conditioning, which is basically we associate them with good things. So dog sees child, ooh, have a meatball. You know, and after a while, over time, the dog starts to think, you know, could you bring that child back in here so I can have more meatballs? You know, and it's basically a way of convincing the dog that the things he was fearful of before aren't really so bad. So lowering the threshold for aggression versus leaving it alone, or even, sadly, increasing it.
Now, how do you work with the pet parent or the owner of the dog in order to reinforce that training?
You know, I find that when they come to class and they actually see, because we can do demonstrations with their own dog. You know, I used to demonstrate with my own dogs, and then I thought, well, you know, they're so obedient that people look at that and think, oh God, I don't know if I could ever do it. What I now do is I demonstrate on their dog to show them that their dog can do it. And so when they see it, you know, when they see a dog starting to do a targeting exercise where they may be hitting my hand for a reinforcement, and then I start being able to move the dog around by moving my hand, they're like, oh my God, my dog is so smart. I'm like, yeah, they are. Yeah, they are. So in that way, they gradually begin to learn that they, not only that they can do it, because it's a mechanical skill and can be taught, but that it also is more fun because now they're not frustrated with the dog as much, and they're also seeing progress. So, you know, like any other skill that you would teach someone. Yeah. And training is an unregulated industry. Everybody that wants to be a dog trainer can just hang the shingle. And so, you know, I belong to an organization now that is now, it's a force-free training organization, and we sooner or later, later this year or early in 2016, will have a licensing credential that's independently tested, and that people will be able to rely on to get somebody to help train their dog that won't use coercion, but who has the skill. So that's going to be a big step in the industry. We're very grateful for that, and you know, that's through the Pet Professional Guild.
And Anne, how would our audience actually get in touch with you if they wanted to? They're probably listening right now.
Right, right, and of course I wear so many hats, you know. But truly, I prefer that they contact me at Senior Care, because if they have, you know, any income limitations, or they're age 60 or over, or they're an adult with a disability or a family member of, our services are totally free. So they need to call me there at 978-281-1750.
Okay.
Or our toll-free number, and that's especially true of residents of Beverly, would call 1-866-927-1050, and my extension there at Senior Care is 569.
Okay, and we'll repeat that at the end of the show too.
All right.
But I just wanted to make sure that our audience knew how to get to you. And now I think we'd like to talk a little bit about what you do there at Senior Care, and how help connect people.
Well, you know, my primary role at Senior Care is actually as their public relations director. So that role basically is go out into the community, go forth and tell people about community-based home care services and other services that help to keep people independent in their own homes or a setting of their choice. So that means home care, it could mean a money management volunteer for the person, and it could mean help with their pet situations.
Right.
So Positive Connections actually grew out of some frustration many years ago. We started the program in 2000, and it began because at that time I was a care manager. So I was actually one of the people going out into the community and setting people up for services and all of that. And my co-workers, who were also either care managers or in some cases nurses, would contact me and say, you know, I know you're in the pet industry. What do we do about my client who has fleas, or my client has this issue with their dog or their cat and we don't know how to solve it? And so I went to the then director of home care and said, you know, we are having these conversations. Is there some way we can put together a program to address it? And so we did. The program is now in its 15th year, thankfully. And largely an information and referral program, because money, as you know, is an issue for all nonprofits and certainly for Senior Care as well. And every dollar that's that comes into Positive Connections is through private donation. We don't receive any state money, any federal money, other than the fact that I'm allowed to do it in the space, and of course my office is paid for by those funds. But generally, the money that goes out to people to help them all comes from donation. So that began to be a program where we would go out and actually talk to people about what issues they were having. They can talk to their care manager. If they have services through us, the care manager knows to refer people to me if they see a problem with a pet issue. And a lot of times it is the pet's health. So, you know, when we talk about dog health, it is maybe we go into a home and we notice perhaps that the people aren't caring for the animal as they might have done in the past. You know, you see dogs with, you know, toenails that are grown over because they can't afford the groomer and they can no longer do it themselves, you know, that kind of thing. Maybe they can't afford the yearly checkup and rabies shot. Those are things that could separate a person from their pet, because as you know, if the animal has an issue and maybe bites somebody and isn't, you know, doesn't have that rabies shot, that's an issue. So we want people to know that they can come to us, you know, to go to the little rabies clinic in their town, or maybe to go and get a wellness check from the veterinarian. So we're always looking for monies to come in so that we can funnel them out to people who may need that service in order to keep the animal in the home safely.
You know, you're bringing up so many points, and I'm thinking about a conversation that I just heard recently. You know, people think about bringing pets to their older parents because they think it will help.
Right.
And I'm sure it will help, but they don't think about the other things that come along with it.
Yeah.
And that's the care and the expense. And I think you really need to think about that before you
absolutely
do
it. The one last issue that people don't tend to think about, and you know, a lot of times it's an elder who doesn't think about it themselves because they may be getting into a stage cognitively where they're not as aware. But you need to have a plan for that animal because it's so unfair, and it happens all over the country all the time. You know, I'm also part of some rescue networks, you know, and so what we see is people delivering the animal who has served this elder or this person with a disability so well, being their companion, and sometimes their only daily companion, and the dog ends up at a shelter because the family either cannot or won't take it when something happens to the person.
Okay, that just happened. I heard about the story through my own experience, and it was very, very sad. This woman passed away, and the family didn't want the dog, but the dog is very happy right now. So
well, that's a good outcome, and we're so glad. We're so glad. But you know, sometimes there are ways in which we can try to mitigate that kind of thing happening. One of those ways is, and I know the rescue and shelter community will be angry with me for saying it, but one of those ways is in how you obtain your animal. Now, I rescued animals all my life. I'm in my 60s. Almost all of my dogs, except one, has been a rescue or a shelter dog. That being said, now that I'm older, unless family members are willing to step in, my next dog could very well come from a reputable breeder, and there are certainly ways to decide who's reputable and who isn't. Reputable breeders show or work their dogs in venues that are public and competitive and can tell whether the dog is now functionally sound for what they were intended to do. They will also take the dog back for the dog's lifetime if you cannot care for it. So unless you have that in a contract, the breeder's not reputable. They also test the parent dogs for diseases and conditions that occur in that breed as a rule that can be tested for. So if the person's not doing that, you don't want to deal with them. But the beauty of that is that if the person passes away that owns this animal, because of that contractual responsibility, the family delivers that dog back to the breeder if they can't handle the care of the animal. And the breeder can then rehome the animal to somebody who's familiar with the breed and who looks for dogs from that breeder. So it is a way of funneling the dog back into a system without putting it into the shelter population, which actually helps shelter dogs indirectly because nobody's taking their spot that they shouldn't take, you see. So I know that there's a lot of people have some very definite ideas in the shelter rescue community, and I prefer to just think, how can we all work together, whether it's breeders, trainers, groomers, pet owners, for the greater good of all of the animals. In other words, keep some of these dogs out of the shelter system and out of the rescue system in the first place.
Well, that was going to be my next question is, what can our audience do? What are the biggest thing that they could do?
The absolute biggest thing is never, ever, ever buy from a pet store or a puppy mill backyard breeder who doesn't do all of those precautions that I just mentioned that responsible breeders do. No matter how cute that puppy is, you're not helping. You're not rescuing pet store dogs. What you're doing is perpetuating a system where the mother dogs live in cages, row upon row upon row, and the puppy's behavioral health is damaged by the condition of that mother. So, for example, a mother that's kept in a wire cage, even if she has all her puppies around her and is feeding and taking care of them the best she can, she's not healthy behaviorally because she's in a totally unenriched environment, and therefore the puppies are not healthy behaviorally. And we see that a lot of times those puppies, even if they're gotten at 8 weeks and the owner takes them home and tries to socialize as best they can, sometimes those puppies still have deficits. So you want to buy from either a reputable breeder, you want to get a rehomed dog from a breeder perhaps, you want to involve a trainer, a competent, professional, force-free trainer early. So for example, I can tell you, on one hand, I can count the number of pet owners who come to me before they buy the pet. I wish they would. I'm more than happy to counsel them. I'm more than happy to tell them, don't buy litter mates, don't buy from a puppy mill. Here's how you tell. And here's how you tell a dog with a nice temperament. So if people call me ahead of time, I'm more than happy to help. And I really wish if people are going to suggest to their elder that they get a dog, to absolutely help them with things like pet insurance, so that they don't lose the dog through financial hardship. And
we are going to have more discussions with you because you are just so filled with information. And I'm actually going to give you this book that I wrote about my golden retriever. And I want to thank you so much for being on our show, because I know the value that you've just given is invaluable.
Well, I so appreciate what you're doing, and I thank you so much for having me. Honestly. It was a joy, and I wish you the best of luck with the rest of your shows, because it's a useful topic, and I'm sure people will get a lot out of it.
Thank you very much. Thanks. And I want to thank our audience for watching Dog Health News. We have a lot of shows coming your way, so we'll look forward to seeing you soon. And thanks again, Ann.
Thank you very much, Roberta. Thanks, everyone.
All right.